Hello dear patients and followers of our YouTube channel. I'm Dr. Ahmedov, hair transplant surgeon from Smart Hair Clinic. Today I'm going to share with you the case of the patient who underwent 2 surgeries in our clinic. This is a 44-year-old white male with a neurotype 4 to neurotype 5 of the hair loss. The first time the patient came to our clinic, it was back in August of 2020. The priority of the patient was to rebuild the front hairline, cover the front side, reinforce the mid-scalp, and do some densification across the front and the crown area if any needed. When the patient first came to the clinic, he asked to lower the hairline. And at that time, because the type of the hair he had, we call it like a European type of the hair every once in a while, like fair skin, fair hair, thin hair with a medium density. We talked during the planning, I explained to him that the best plan for now would be to preserve his own hairline and try to give him more coverage and density to the upper sides of the head. And if needed, with the second surgery, add more density to the front side. And at that point, if you have sufficient number of the grafts, do some revision to the front hairline. With the first surgery in August of 2020, he had the 3,700 grafts transplanted to him. The front hairline was preserved and reinforced. The front part, front mid part, and the entrance or the 5th level of area number 5 in the entrance to the crown area was reinforced. 3 years later, in 2023, the patient came for the second surgery. The plan for the second surgery was the revision of the front hairline, take it slightly lower and increase overall density in the transplanted areas. Every once in a while, to acquire the good density and the coverage, second surgeries may be needed. And this patient is a good example on how a 2-step surgery can efficiently give a good result, especially for the patients with thinner hair or limited donor area. The 2-step surgery is always a good option because we don't push the donor area to the limits. We avoid too much scar formation at the back of the head, and as a long term, it gives the best possible outcomes as the density and the coverage. With the second surgery, the patient had 3,100 grafts transplanted. What we did, our priority was to reinforce the front hairline, give it more density, but mainly take it lower and make the revision of the hairline due to his expectations. It was done, and as I told you, 3,100 grafts were transplanted. Some reinforcement of the front mid part was also carried out. And now you can see the results of the patient around 1 year after the surgery. You can see that the front hairline is really stable. It's good. It starts with some thinning in the front hairline as it naturally should be, and some good density to the back of the head, higher density to the mid-scalp and the upper sides of the head. Here comes the answer to the questions, how many surgeries I need actually. For everyone it's different, but starting from neurotype 5 of the hair loss, most of the time, a 2-step surgery is needed to acquire the good density and the coverage. But for some patients, it may be even neurotype 4, depending on the size of the recipient area or the donor area capacity. So 2 factors here is that what's the degree of the hair loss the patient has according to the Norwood-Hamilton scale, and what's the capacity of the donor area. Because we always tell to the patient, the best one is that we can be hero as the donor area led us to be. And the good surgery is when you do plan the surgery according to expectations, donor area capacity, and the recipient side capacity. If you have any questions to ask, please leave them as a comment underneath the video. We'll get back to you as soon as possible and answer all your questions. Thank you.